This segment is sponsored by Orthopaedic Associates of Muskegon. Dr. Jeff Recknagel is my host. We are here to talk about a procedure called stemless shoulder replacement, and I know that it has benefits, many of them, but let's start by talking about what it is.
Well, a stemless shoulder replacement is a shoulder replacement that covers the arthritic ball at the top of our arm without putting a stem down inside the bone. Traditionally, with shoulder replacement, we place a metal stem that goes inside the bone that we have to take bone out of the inside of the bone and then make a cut across the top of the ball and then replace it with a metal ball that attaches to that stem. With stemless shoulder replacement, it's a less invasive operation where we place an implant at the top of the arm without taking that bone out of the canal. The other thing that you may notice is that the cuts at the top of the bone are what we call chamfered cuts, more like you cut a diamond, and preserve more bone, so it's bone conserving. Then this implant lays on top of that surface and gives us that smooth surface instead of that rough surface.
So I hear bone conserving and I hear less invasive, but what are the ultimate benefits beyond that for the patient?
With what we found with that type of implant, because this is a more anatomic fit, this ball is more flattened, more like the anatomy that is normal. And so my patients notice that their shoulder feels more normal. They have a more normally functioning shoulder and able to reach better, less pain.
And is this appropriate for everybody? Because is anybody doing the old way then, you know, the hollowing out?
The old technique or the older technique of placing a stem in is appropriate for some people that have bone loss or that have to have more stability of that implant. And for patients that do not have an intact rotator cuff, then this is not the appropriate operation. There are different operations we do for that.
Got it. I also understand there's the use of a particular technology that allows the placement of this piece that is super helpful.
Well, technology continues to touch just about everything in orthopedics, and so one of the things that I do before the operation is to obtain a CT scan or CAT scan of a patient's shoulder and then model their anatomy with a three-dimensional model before surgery. That allows us to see any variance of that patient's anatomy and plan for that at the time of surgery. That also allows us to place an instrument on the patient's socket to place an implant in the perfect position on that socket too.
So for the patients who've received this treatment, what is that return to function and return to normalcy for them? What have you seen in the patients who've had this?
What I see is patients that come back even at 2 weeks that describe that their shoulder feels much more normal. They're able to reach over their head and do things. And then patients that are further out have been able to go back to playing golf or playing sports or doing different types of activities. Activities that like pressing away from their body that they couldn't do before, and then they feel more normal doing that again.
Probably some things that they thought they'd never do again, right?
Right.
Playing a game of golf or just using that shoulder normally.
Right.
All right, well, if you would like to learn more about the procedure and what's happening here at Orthopaedic Associates of Muskegon, you may do so on their website. We have put a link to it on ours. Go to 13onyourside.com and you'll find it there. Dr. Recknagel, thank you so much.
Thank you.